Hi, my name is Dr. Jake Psenka, and I'm speaking to you from the Chambers Clinic of Integrative Medicine in Arizona. I've been helping people fight cancer with integrative medicine for nearly 20 years. And over those 20 years, I've learned that it's much easier to prevent cancer than it is to treat cancer. So I'd like to talk to you a little bit today about what you can do to prevent cancer. There seems to be a big misconception about who is going to get cancer and who isn't. Most people think that if they have a family member who's had cancer, that they're destined to get that diagnosis as well. The truth is that only about 15% of cancers are inherited. 85% of cancers are actually preventable. Every year in the United States, about 1.8 million people are diagnosed with cancer. If 85% of cancers are preventable, that means that theoretically we could prevent about 1.4 million cases of cancer per year if people would adopt a healthy lifestyle pattern. Imagine what that would be on a global level. Everybody knows that eating well and exercising is good for them, so why don't more people do it? I think the answer is that most people fear that if they try to make lifestyle changes, they'll have to eliminate all the foods that they like, or they'll have to spend hours and hours in the gym trying to build excessive amounts of muscle. The fact is, it's easy to start eating a healthy diet. The first step is to understand why it's important. Because if you understand why it's important, then you're actually going to feel motivated to start adopting some healthy dietary changes. The most important thing you can do is to start adding foods into your diet that give you health benefits before you start taking things away. And then, once you've added those healthy foods to your diet, it's easier to start minimizing or even getting rid of some of those foods that might be causing you to have some increased risk. Some recent research pointed out that one of the most powerful things a woman can do to prevent a recurrence of breast cancer is to exercise. And that research really suggested it was just 2.5 hours per week of some moderately brisk walking that reduced the risk of recurrence by a whopping 46%. That's more than anything else in the world that we're aware of. In the office, we can cover all aspects of the disease, from working on prevention protocols to integrative treatment that people can use while they're going through conventional treatment to aftercare to try to reduce the risk of having recurrent disease. If you'd like more information about the treatments that we offer at the Chambers Clinic, please use the number below and call one of our clinical coordinators today. Thanks.